Scenario 2, diabetes and subsequent diagnosis. Uncontrolled non-insulin dependent diabetes mellitus. A 58-year-old female with non-insulin dependent diabetes mellitus was seen in her primary care provider's office with reports of diminished sensation in both feet and occasional blurred vision. The client admits to problems adhering to her prescribed dietary and medication regimen. She doesn't exercise regularly, takes her medications only when she is reminded, and doesn't watch her diet. She denies dyspnea, polyphagia, polydipsia, polyuria, and diphorsias. The client had a history of non-insulin dependent diabetes mellitus for 15 years and dyslipidemia and hypertension for 8 years. She had laser photocoagulation for retinopathy in the past year. She is on metformin and glipizide for control of hydrochlorothiazide and ramipril as antihypertensives and atorvastatin for hyperlipidemia. Upon examination, her blood pressure is 185 over 90 milliliters of mercury. Fasting blood glucose is 265 milligrams per deciliter. Hemoglobin A1C is 9%. Serum blood urea nitrogen and creatinine at 53 milligrams per deciliter and 4.4 milligrams per deciliter, respectively. Urinalysis and 24-hour urine collection uncovered trace protein and urinary albumin excretion rate of 255 milligrams a day, leading to a diagnosis of microalbuminuria. Nerve condition studies and electromyography confirmed diabetic neuropathy, decreased visual acuity, and new extensive reticular vascular growth were revealed through an ophthalmologic exam. Based on the client's typical presentations, the final medical impression and diagnosis is uncontrolled insulin-dependent diabetes mellitus, complicated by hypertension, dyslipidemia, neuropathy, retinopathy, and microalbuminuria.